Welcome back to the programme. NHS leaders in Scotland have discussed abandoning the founding principles of the health service by having wealthy people pay for their treatment. The discussion of a two-tier system was mentioned in draft minutes of a meeting in September. Joining us live from Leeds is Dr. John Puntis, co-chair of Keep Our NHS Public. Hello, Doctor. Thank you very much indeed for joining us. Explain to me why you think it's important, even in a cost of living crisis and an NHS, which has reached some kind of crisis too. There doesn't seem to be much question about that, to keep the principles as they were, which is treatment free at the point of service to everybody. Why do you think that should stay as it is?
Hello, Vanessa. Yes, I think it is really important. I think the founding principles have served us very well. They're fair. We all pay in according to our means through taxation. We all have that worry of not being able to afford care removed from us. That's worth a huge amount. And we treat people on the basis of need rather than on the basis of ability to pay. But to put this in context, the same kinds of discussions are going on in England. You've had the NHS Confederation saying that the amount of money going to the NHS is not adequate to continue to provide all the services that are currently provided. You've had NHS England recently saying exactly the same thing, that developments in primary care, A&E, mental health, cancer treatment, all these things are under threat because of not having enough money. And essentially that's forcing us into a two-tier system.
But I mean, some people will say, Doctor, that we already have effectively a two-tier system, or indeed you might say differently, you might describe it as an opt-out system. So we have private healthcare, we have PPP and Bupa and other insurance companies, and some people's private healthcare comes courtesy of their job. You know, it's part of the package of employment that they get some kind of healthcare included. And people who pay privately to go privately for healthcare are able to often see a specialist or consultant more quickly. They pay for their operations, or they're insured and their insurance company pays for their operations, so they have their operations more quickly. And many of the most distinguished NHS consultants trained within the NHS, still working in the NHS, also see patients privately, and that's how they boost their income. And so they don't take away from their performance in the NHS. They're no less devoted to working in the NHS, but they see their private patients after hours or at weekends, and they operate on them in private hospitals after they've done their NHS operating list. So you might say this is already happening, that people who can afford to pay or have jobs that want to pay have private health insurance and go privately already.
Yes, you could say that, and there's an element of truth in that, but there's also problems with that kind of system as it works at the moment in terms of undermining NHS care by taking surgeons out into the private sector. It does introduce difficult conflicts of interest, I think. And in fact, the private capacity is quite small. The number of consultants doing private work has actually gone down. And it's NHS consultants, as you said, that work in the private sector. So if they spend time in the private sector, certainly if they spend more time in the private sector, then they're doing less stuff in the NHS.
But it exists. I mean, you're not going to get rid of private medicine, certainly not, particularly not at a time like this. But there will be people listening and watching who will be thinking, look, if you can afford it, if you have the money, why shouldn't you pay, and maybe pay at the point of service in an NHS hospital? You know, why shouldn't you, for example, be charged for bed and board? You'd have to eat food at home, you know, you'd have to have clean sheets at home, you'd have to pay for it. If you can afford it, why shouldn't you pay for it in the hospital? Likewise, bandages, dressings, all those sorts of things. If you can afford it, why shouldn't you pay for it? Why shouldn't paying for your own good health be your first priority when it comes to spending whatever money you have, if you can afford it? Obviously not if you can't afford it.
Well, I think if you think of emergency care, for example, very few people would be able to afford that kind of level of a cost if they are unexpectedly ill. And this is one of the great things about the NHS and its universality. It's there as a safety net for all of us. And as I said, I think people paying privately. Yes, that goes on at the moment, but it doesn't benefit the NHS. I think the private sector is largely parasitical on the NHS. It doesn't train its own staff, for example, and it does cause certain difficult problems. For example, with cataract surgery, you now have a lot of cataracts being done in the private sector, and that actually deprives surgeons in training of experience, and it means that it's much more difficult for the complex patients to be operated on within the NHS. So there are knock-on effects of promoting the private sector.
I mean, that is one way of looking at it, but the other way of looking at it is anybody who has their operation done privately in a private hospital and their insurance company usually pays for it, takes themselves out of the list, therefore their name is not on the waiting list, therefore the next person who would have been behind them on the list now goes one person forward because they're no longer on the list, that they are shouldering and paying for some of the burden of the NHS, and the NHS is collapsing under the burden. So anybody with private health insurance who is paying an insurance company not to have to be on an NHS waiting list or sit in an NHS ward or take up NHS resources is actually doing the NHS a hell of a favour, because you say they've paid their national insurance all their lives, they paid in just like everybody else, but they're not taking out. So that absolves the NHS of the cost and the time and everything else of looking after them.
Well, sadly, it doesn't work like that. As you said, it's NHS consultants who are doing the sessions in the private hospitals. So if they're working in the private hospital, they're not clearing the NHS backlog.
But you heard what I said. And I used to be married to an NHS consultant, an orthopaedic consultant, so I do have a little experience of this, although the marriage somewhat short-lived, only 14 years long, 2 beautiful children as a result, though. And I was married to an orthopaedic consultant. And you know, in the NHS, as you know, you have to fulfil your quotient of operating. You have to do your ward rounds. You have to, if you're a physician, you have to be there for a certain number of hours, seeing a certain number of patients. You can't welsh out and not do it. You have to do what you're paid to do, and you have to be there for when you're paid to be there. But as I said earlier, at weekends, late in the evenings, at other times, maybe very early in the mornings, you can fit in, if you're hardworking and want to do it, your private clients and your private operating list. So I think most NHS consultants who also do private work will say that they're not robbing Peter to pay Paul, and they're not denuding the NHS of their good offices, that they're doing both.
Well, the consultants that I knew, and there were 1,100 in my trust, the ones that opted to do private practice decreased their NHS sessions, so they didn't work full-time for the NHS. But I think this is straying away from the main issue, which is lack of funding for the NHS to do its job properly. And if the NHS is well funded and provides a good service, people then don't choose to go privately.
Well, let's take a call, Doctor. You can listen to this call and certainly you can respond if you will. It's my caller Shane in Edinburgh. Hello, Shane. Good afternoon to you. Thank you for ringing.
Good afternoon, Vanessa. Lovely to see you this afternoon.
Nice to speak to you. Tell me about the NHS.
I'm delighted to hear Dr. Puntis' views, and thank God there are people like him in the world that are speaking up on this point. One of my points is that if you start taking away the universality of the NHS and start where people are the better off are asked to pay something towards their treatment, what you will do is you will turn the NHS into a service for the poor, and consequently, instead of a universal service, which from the highest to the lowest, Prince Charles can have treatment on the NHS if he wants. And when you were talking about paying national insurance and all that, Vanessa, I'm afraid you are wrong. Only the NHS is principally paid for from general taxation revenues, and only a tiniest proportion of it comes from national insurance contributions. Right. The real issue is the NHS is cash starved. It hasn't got adequate resources to provide for patients' needs, and this tinkering that is being proposed by NHS Scotland is catastrophically disastrous. And I can tell you now, if it comes to pass, the SNP, I believe, will cook their goose in terms of any prospect of independence. This is something that people in Scotland will turn on, and I believe people throughout the UK that appreciate the NHS will stamp hard on it. Can I just tell you, I'm already paying for healthcare in Scotland. My surgery, I've needed 2 recent referrals, and I have already spent in the last year about £2,000 on private medical bills because I fair enough, I have the money,
right.
but that's not the point. I am committed to the NHS. I think it's the most. We'll spend fortune on the monarchy. We'll have all these celebrations to do with Prince Charles being crowned, and it'll be hugely expensive. But when it comes to providing money for a service that is absolutely essential, I think this government and any other government that wants to change it needs a boot up the backside.
All right, Doctor, you respond to that call.
Well, we're on the same wavelength. I'm delighted to hear what was said by that caller. I couldn't agree more.
But he also said that he spent £2,000 in the last few months on private treatment because he felt he had to and he had no choice. Luckily, he could afford it, which doesn't that kind of detract from the argument of the purity of the sanctity of NHS being free on delivery?
No, I think that what that tells me is that the NHS services are poor at the moment, forcing people into making these choices if they can afford it. Of course, a lot of people can't afford it. And the answer is to properly fund the NHS.
Thank you, Doctor, very much indeed. Pleasure having you on the programme. What do you think of what the doctor just said? What do you think of our caller's share?